Hello, this is Dr. Chytanya Deepak, Consultant Psychiatrist and Director at Asha Hospitals, Hyderabad. Today, let us talk something about OCD. OCD is a very common psychological disorder where a person will have repeated thoughts, and because of this, repeated behaviors happen. So, obsession, that is the thought component, and compulsion, which is the behavior component. That is, a person keeps getting a repeated loop of thoughts which they will get stuck into. For example, the table is not neat. So, for all of us, we all might be like thinking about cleanliness and we want to keep things clean, and this is a normal part of life. That wouldn't be actually OCD, though we use it like I am so obsessive about keeping things orderly and I am so obsessive about keeping things clean and all these things. But whereas a disorder of obsessive compulsive disorder is the person knows that the table is clean and the person has cleaned that table, but still they get the thought that may be some dust on the table, so they need to clean it further. They will keep repeating this, that is 10 times, 20 times, and the number doesn't have any limit. So they get this repeated thought that this is not clean, or various other thoughts. There are multiple forms of thoughts, but the concept is that they get this repeated thought and they are not able to calm themselves with that thought. So they will have to do a behavior like, example, cleaning. So they keep repeating that behavior too. So sometimes it can be so severe that the whole day gets spent in thinking about the cleanliness of the table and cleaning the table. Similarly, the hands might be dirty, the door might not be locked properly, or I didn't lock the car properly, I didn't check the door of the house properly, or there is something lying down, or maybe some kind of thinking like if I don't walk this particular way, something bad can happen. So there are various kinds of thoughts that can happen, but the fact is that they keep repeatedly thinking about that and they're not able to control that thought, and to reduce that thought they do some behaviors. So this is known as obsessive compulsive behavior. So we need to be clear about being over clean or over punctual or these kind of things, and is different from an obsessive compulsive disorder. Being over clean or over punctual and all those things, you don't need treatment. But whereas if you are getting stuck in such kind of loop and you're not able to get along with your day-to-day life, you definitely need to seek professional help like a psychiatrist and a psychologist. And there are various modes of treatment for this, like medications, behavior therapies like ERP, and neuromodulation techniques like deep TMS. So all these methods can help in relieving these thoughts and reducing the anxiety associated with these thoughts and reducing the repetitive behaviors of an individual. And we also have this notion that if I go to a psychiatrist, people will call me mad. That is also not true. People can go for various reasons. There are multiple disorders for which people can go to a psychiatrist, and OCD is one among those things. So we need to seek help, and we should not stigmatize this thing, so that people who are in need of this illness, who needs treatment, should be able to go to the doctor and seek proper treatment for the illness.